So understanding the new Medicare Part A and Part B costs for 2026 are more critical than ever. From 2025 to 2026, we're seeing higher increases on a percentage basis than what we've seen in the past when it comes to original Medicare premiums, deductibles, and cost sharing. So understanding these changes are more critical than ever because if you don't, you could end up with some surprise bills or potentially missing an opportunity to change your coverage. So let's get into what the changes are from 2025 to 2026 as far as your premium cost and your cost sharing for Part A and Part B. So some of the changes as far as a percent increase, we're going to see a rise in the Part B premium. It's going up by about $18. You're going to see an increase in the Part B deductible. We'll get into the exact numbers. The Part A deductible and the hospital coinsurance. So the Part B premium here, 2025, it was 185. For 2026, you're seeing about a 10% increase. It's going up to 202.90. Okay, so this 10% increase, it's about the same as it's adjusted for the cost of living partially, but it's high. It's a higher increase than what has been in prior years. Okay, so now that is for 90%, about 90% of folks are going to pay that 202 premium, but this is a chart that reflects what your premium could be if you face what's called an income related monthly adjustment amount. So if your income is over these thresholds here, you could face a higher premium. So you could see if you're married filing jointly, if you're in this bracket, you're paying an extra $81 a month. So that would give you this $284.10 total premium. The other thing that a lot of times people forget is there's also this surcharge on Part D. So again, it's important to remember that Medicare, they don't offer prescription drug plans. They do set what's called the standard model, which the insurance companies have to abide by when formulating their drug plans and offerings. Now, there's no premium for Part D from original Medicare. There's no premium from Part D from original Medicare standard for folks that are, below these set income brackets here. But if you have a Part D plan from a private insurance company and you make over these income amounts, then you do face a higher premium that they would add on to your bill that you get from Social Security if you're not taking Social Security. If you are taking Social Security, they would add that to what is deducted out of your Social Security check that you would get every month. Okay. And again, these are based on this formula, modified adjusted gross income. So the modified of the modified adjusted gross income is they add back in certain forms of tax exempt income, such as portions of your Social Security income that's not taxed, or foreign earned income, as another example, would be added back onto that adjusted gross income amount. So I believe that is line 11 on the 1040. That's your AGI. But then again, the modified is they're adding back certain forms of non-taxable income. Okay. So these are the changes for 2026 for your Part B and Part D IRMA surcharge costs. Okay. Now the Part B annual deductible, you're seeing that's going up from $257 to $283. So again, about a 10% increase. So the Part B deductible, if you have a Medicare supplemental plan and you're new to Medicare, you turn 65 after 2020, usually you're going to hit this Part B deductible for outpatient costs before your Medigap plan would pick up. If you have a Medicare Advantage plan, oftentimes you don't have this Part B annual deductible because, again, Medicare Advantage, they're taking over from original Medicare as the primary payer. Okay. For folks on original Medicare, then you will certainly notice that your out-of-pocket cost for Part B coverage services is going up for 2026. So the Part A hospital deductible, Again, most secondary plans, whether it's a Medicare supplement or again, a Medicare Advantage plan, you don't necessarily experience this if you have one of those plans because most Medicare supplement plans are picking this up, or the Advantage plan again is taking over as primary payer from original Medicare. But you can see the Part A standard deductible is up to $1,718 in 2026. So there's a Part A hospital cost sharing or co-insurance, a per day copay. So the first 60 days, you don't pay anything when you're in the hospital if you've satisfied that deductible. Once you're in there for days 61 through 90, it's important to note that this is lifetime. In 2025, you had a copay of $419 a day. And again, that's going up to $434 a day. Once you exceed 90 days of inpatient care, then that copay is going up from $838 to $868. And again, this is the cost with original Medicare Part A. Okay, so there's a skilled nursing facility coinsurance. So Medicare Part A, you have a set copay for days 21 through 100 if you have to be in a skilled nursing facility. So often this would be like a rehabilitation center. So if you're an inpatient for 3 days in the hospital, they discharge you into a skilled nursing facility. There's no cost for the first 20 days, and then days 21 through 100. 2026 is going up to $217 a day from $209.50 a day in 2025, which, as you can see, represents about a 3.5% increase. Okay, now most people do not pay a premium for Medicare Part A. Okay, but this also depends on the number of work credits. So work credits is essentially 40 quarters or 10 years of paying into Medicare tax. Once you've done that, you don't have a premium for Part A. But there are folks that don't quite have 40 quarters or of work credits, right? So if they're in this less than 30 quarters, their Part A premium is going to go from $523 to $572. A lot of times you'll see this, folks they'll move to the US, when they're retiring or if their kids live here, oftentimes that's the case. Or folks that work 30 to 39 quarters, you have a lower premium for Part A. So in 2025, it was $285, and you can see that's going up to $311. But again, if you're in that 30 to 39 quarters, oftentimes people may, get a job for another few years, a part-time job to meet the requirement for the work credits as well. So that's how the Part A premium works. Most folks don't pay a Part A premium, but again, if you fall into one of these two categories, you will see an increase from 2025 to 2026. Okay, again, this was the example of 30 to 39 quarters. Okay, so cost changes, you're seeing anywhere from a 3.5% to a 10% increase when we talk about Part A premiums, deductibles, and then the Part B deductible and the Part B premium. So you see those increases there as well. So, this is pretty standard. These changes will, happen every year, right? So typically you'll see an adjustment. This year was a little bit higher than years past. So again, just something to keep in mind as we go forward. If you want to check out more videos on Medicare, we have another one posted up here that you can check out as well. Okay. And thanks for tuning in and joining us.